Good day, family. And on today's video from MBBS Niger, we'll be talking about the elbow joints. We'll be talking about the bones that make up the elbow joints. We'll be talking about the ligaments of the elbow joints. We'll also be talking about the various articular surfaces. We'll be talking about the ligaments that also stabilize the elbow joint. We'll also be talking about some few clinical correlations of the elbow joint. All right. So if you are watching this video from any part of the world, kindly like and comment on this video, and also follow our YouTube channel. Subscribe to our YouTube channel so you could get to see more and more of our updates. All right. So the elbow joint is a uniaxial and synovial hinge joint. It results from the articulation of the trochlear capitulum of the humerus, all right, and the trochlear notch of the ulna and the head of the radius. You could see the picture on the right, the picture of what I'm talking about. And the articular surfaces are covered by the hyaline cartilage. You could see from here, right? So you could really observe that, right? So it forms from this attachment, right? So talking about the capsule of the elbow joint, okay, we'll talk about the capsule of the elbow joint, the capsule that surrounds the elbow joint. Anteriorly to the humerus along the upper margin of the coronoid and the radial fossa, and to the front of the medial and lateral epicondyles. This is us talking about the capsule of the elbow. Below, to the margin of the coronoid process of the ulna, and to the annular ligaments which surrounds the head of the radius. All right. Still talking about the capsule, posteriorly to the margins of posteriorly above to the margins of the olecranon process. Can you see everything I'm talking about? The picture is on the right. Now below, to the upper margin and sides of the olecranon process of the ulna, and to the annular ligament. Okay, this is talking about the capsule of the elbow joint. Now we'll be talking about the ligaments of the elbow joint, all right, and their locations. And the ligaments of the elbow joints are the ligaments that actually make this joint a stable joint. All right. So the lateral ligament, also called the radial collateral ligament, that is on the radial side. It is triangular in shape. All right. The apex attached to the lateral epicondyle of the humerus. Okay. The base attached to the upper margin of the annular ligament. You could see this image depicts the annular ligament. You could see the radial collateral ligament here. Okay, so moving, still talking about the ligaments. If you have the ulna, if you have the radial collateral ligaments, you should have the ulnar collateral ligaments. And the ulnar collateral ligament, definitely it will be on the ulnar side, so it will be on the medial side. Okay, so you could see the ulnar collateral ligament, anterior strong cord-like band, right? The ulnar descent, the ulnar ligament. The ulnar ligament is divided into three parts, right? You can see the anterior band, you can see the posterior band, you can see the transverse band. This is what I'm talking about. All of them are collectively called the ulnar collateral ligament. Okay, so moving on, we'll be talking about the synovial membrane. Definitely the synovial membrane is like a lubrication to to the elbow joint. Okay, the synovial membrane is like a sac of lubricant that lubricates the elbow joint. All right, and it lines the inner surface of the capsule and covers fatty pad in the floor of the coronoid and radial and olecranon process. The synovial membrane is continuous below with the synovial membrane of the superior radio-ulnar joint. You can see this picture here. This is what we are talking about. You can see the synovial membrane from the elbow. You could see how continuous it is with this the synovial membrane of the upper radio-ulnar joints. Oh. Right. So, I think we are making so much progress, right? We're done with the medial, collateral ligament and so on. We're done with the synovial membrane. We'll be talking about the relations of the elbow joint. This is like in anatomy when they tell you relations, okay? This is like the reason why, okay? The structures that are related to you that makes it important for us to single you out so we could study you properly, okay? So you could see this slide, you could see the image of the elbow joint on the right, and you could see that there are various important nerves that pass through the elbow joint, making it so much important for us to study the elbow joint. Now anteriorly, the elbow joint is bounded by the brachialis, the tendon of the biceps, the median nerve, and the brachial artery. Okay, posteriorly, it is bounded by the triceps muscle and the small bursa intervening it. Although we don't have everything on this picture, but this picture is just showing the nerves. Of course, when nerves pass through you, it makes it the most important reason why we will study you. Okay, so medially you can see the ulnar nerve, and this region is also called the funny bone region. Okay, when you touch the ulnar side of your elbow joint, you actually feel these tingling sensations. Okay, these tingling sensations are known as the funny, that's why they call it the funny bone. Okay, so the movements of the elbow joint, what movement does the elbow joint permit? Of course, you know that bones permit some degree of movement, okay, except the suture joints that can be rigid. Joints permit some degree of movement. Okay, so now you can see that the elbow joint permits flexion. You can actually bring your hand to touch your shoulder. All right, that is flexion. Now extension, you can actually take your hand to touch your hips, that is flexion. Okay, we'll also get to learn about the carrying angle. This is the angle that actually push your hand some distance away from your hips in the normal walking posture to avoid your hand colliding with your hips when you walk. That's the carrying angle. We'll get to look at it. All right, so next we have the carrying angle, and it is the long axis of the extended forearm and the long axis of the arm. Okay, you can see this diagram here of the carrying angle when you stretch your hand, and the line passing through your forearm and the line passing through your arm at the place where they join at the elbow joint. You see the carrying angle there. So you can see that the elbow joint has a cubital fossa, has a carrying angle, and has a lot of other important structures. That's why we study the elbow joint. All right, so going down, we'll be talking about some clinical correlations of the elbow. All right, you could see that elbow dislocation, dislocation from the posterior. All right, you can see it usually results from falling on your outstretched hand. You want to fall, then you use your hands to like support your body so that you don't fall. This can also cause elbow dislocation. Okay guys, we are moving on. We could see that avulsion of the epiphysis of the medial condyle, right? You just look at this picture before you try understanding that English I just doled out. Now you could see that the flexor muscles that originate from the common flexor origin are actually chopped off. Okay, I hope you are seeing it. Fall on an outstretched hand with the elbow in full extension. Right. So next, I think we're done. There's some few questions I'll be sliding through so slowly. If a question is of interest to you, you could like just pause this video and try to see through. Question 3: which muscle is the powerful spinator? That should be bicep brachii. Then thank you. Okay, if you are watching this video from any part of the world, kindly do subscribe to this video to our YouTube channel so you could get to watch more and more of our videos, the MBBS Niger YouTube channel, so that you don't get left behind on new videos that will be doling out. Okay, so thank you guys for staying tuned to this our episode on the elbow joints, and see you guys next time, same channel. Okay, MBBS Niger, we are out.